So we'll start with introductions. My name is Anna Richard, and I am the Director of Children's Services here at the Champion for Children Foundation. Today, I'm going to ask you guys to answer the question of how do you like your eggs cooked or served? And if that's a hard question, we'll have a problem. No, I'm just kidding. If you don't like eggs at all, just tell so. But how do you like your eggs cooked and served or served? So your name, where you work, and go from there. And as always, I'm going to start picking on my own team. I'm actually going to go with Carissa first.
Good morning. My name is Carissa Marie with the Champion for Children Foundation, and I like my eggs over easy.
Okay, CJ Wingate. I'm the family research specialist, the new kid on the block, but I've been with Champion before, and I like my eggs scrambled.
My name is Katie Pippin, and I'm with the Champion for Children Foundation as the Executive Assistant and Graphic Designer. And I am a little bit of an egg snob, being honest. It's very important, the temperature, the texture, and if it's salty, I like them poached. I don't like the whites runny. I actually like the yellows runny. And if it's deviled eggs, I like it to be real mayonnaise and dill pickles in it.
Awesome, thank you. How about Miss Sarah Beth?
Hello, I am Sarah Beth Rogers at the Children's Advocacy Center, and I am not picky about my eggs whatsoever. I love eggs, whether they're scrambled, over easy, over medium, over hard, poached, dipped in bread and fried up like that to make French toast. Anyway, I like it all.
Awesome, thank you. Miss Cynthia?
I unmute myself, you all may hear me. Good morning. I am actually the opposite. First, I'm Cynthia Acevedo, Program Manager for Healthy Families. I don't like eggs as much, actually. But if I'm going to have eggs, they need to be scrambled dry, and I have to have onions and peppers and cheese in them to make them taste good to me.
Very nice. All right, Miss Bernadette.
Good morning, everyone. I like eggs anyway also. The only time I don't like eggs is if they're powdered, but I do love eggs. I think if I have a choice, it would be poached.
Okay, thank you. We have Chris and Dana. Are you guys there today?
Yes, ma'am, we're here. Sorry for no video today. We're just kind of in our children's ministry office, which is an awful mess. But anyway, so yeah, we got a million things going on, so we're having to work in the office today. But for me, I'm Chris Haddon. I'm the children's director here with my wife Dana, and we're the directors here at Bible Fellowship Church. And we're also directors and managers of Hope Ministry Community Outreach. So with eggs, I'm like some of the others. I like them any kind of way. My preferred is over easy.
All right. And Dana?
Over medium.
Dana said over medium.
Over medium. Dana's over
and ditto
medium.
to everything else I said.
Okay. I love you guys so much. All right. And then we have, let's see, you guys are moving around on my screen a little bit. We have a new member today, Miss Sheila.
Good morning. I had to figure out how to unmute myself. My name is Sheila Hubanka. I'm the school health coordinator. I work at the Department of Health, and I like my eggs made into an omelet, and my sweet husband makes me an omelet for breakfast every morning.
Oh,
how sweet is that? Well, welcome to our group. And then we have another new member, Miss Katie.
Good morning, everyone. My name is Katie and Parchment. With Heartland for Children. So I'm actually sitting in for Baruch today, and I'll probably be kind of taking his position just for today, unless other needed. But I like my eggs either fried hard or scrambled hard or boiled, and also omelet. But no matter which way I have my eggs, I must also have hot sauce.
Nice. It's like you were prepared.
Keep it at my desk.
I love you already. All right. Thank you, Katie, for joining us today and standing in for Baruch. And then we have Felicia. Can we hear you today? You're muted. You gotta unmute yourself first.
Can you hear me now?
Yes. Yes.
Good morning. My name is Felicia Dozier. I am a counselor and faculty member here at South Florida State College. And I love my eggs diverse. An egg is an egg. Any way you cook it, I eat it.
Any way you cook it, I'll eat it. Okay.
You got that right.
Thank you. Thank you so much. All right, and then we have Victor.
Hi, how you guys doing?
Good. How are you?
Doing all right.
You want to introduce yourself and tell us how you like your eggs cooked or served?
Oh, well, I'm a victim family advocate from the Children's Advocacy Center, and I like my eggs cooked. I like eggs Benedict, poached.
Nice. All right. How about Elizabeth? Liz.
Hi, my name is Liz Fisher. I'm a victim advocate with the Highlands County Sheriff's Office, and I like my eggs over easy.
Very nice. All right. And then we have Mercedes.
I'm Mercedes McNew, the admin of the Children's Advocacy Center, and I'm allergic to eggs.
Allergic to eggs. Okay, it's good to know. All right. So, Marisa, are you there yet?
I am here. Sorry, I was late, you guys.
Awesome.
Hi, I'm Marissa Spam. I'm the Executive Director of Salons to Family Project and also serve as chair this year for the Children's Services Council. I love my eggs over medium with avocado toast.
Love it. All right. So, I didn't say how I like my eggs, did I? I like eggs as long as they're not undercooked or overcooked. Anyway, it's fine with me. So there we go. Now, I hope that was an easier question today, but there is also always a reason to why I ask my questions. So I want you guys to take a jab on it. Why would I ask this question to you guys? Any ideas?
You gonna cook for us?
No.
So that we can appreciate diversity.
Absolutely. Absolutely. Anyone else that want to give it a jab?
To demonstrate how everyone is different.
Yes. Yes, absolutely.
Maybe we all have kind of the same ultimate goal, but different ways of getting there.
Very nice. Yep. You're all right. Anything else?
What works for one may not work for all.
Perfect. Anything else that you can think of? Okay. You covered it all, so I don't have to go over the points. So the reason why I asked today was, yes, diversity. We're all different. We all like different things, but we're still working on the same goals, eggs, I guess, whatever you want, and so forth. And today, as we're going to work on our strategic plan more, just keep in mind that if someone throws out an idea, It might be a great idea, but maybe not work for you. That does not mean that we just go, nope, we're not doing that. Let's see what the possibilities are with each idea that comes up today and go from there. Does that sound all right? Also, I guess there was something that stood out last meeting that kind of came with the egg idea that I want to read to you. It was something that Varuch actually said. And if you read the agenda today, you would already have read the quote I took from him. And it says, "What inspires me is our community. Seeing people from such vast different walks of life come together to address shared issues. Despite our differences, we're able to have a shared vision." And I just think that was so beautifully said. I'm sorry that he's not here today, but maybe that's okay because I do think I spelled his name wrong on that quote, and I apologize. With that said, you guys, let's go quickly over the minutes from last time to get everyone up to par. And I just want to remind everyone, if you do miss a meeting, there is the meeting minutes, or it is the, you can watch the virtual meeting on our YouTube channel. How many in here have, by the way, subscribed to the channel or looked at it, know what it is? Woohoo, one person, go team. All right, we can do better, do better. All right, here we go. Last time we had 16 attendees, and honestly, I did a lot of talking last time. I kind of introduced myself a little bit better to the group overall, and we did a recap of everything that we've done so far. This is our 5th meeting today. We talked a lot about how this is kind of like laying a puzzle, and we bought into the idea. We bought the puzzle box, right? The picture of it, building a trauma-informed community, and we kind of emptied out the puzzle pieces on the table and said kind of like, now what? Let's try to put the pieces in order, and that's kind of where we're at today. We're going to start working on our strategic plan. I shared a story last time about a little trauma story, and we discussed a couple of questions on that, which really came out to say that, you know, even a small difference of just understanding trauma and being aware of it can make a huge impact to the people that we interact with. We also talked a little bit about the resilience documentary and the TBRI intertraining that Varuch and Marisa did and what we took away from that. And then we had a little bit open floor discussion at the end and so forth. So in a nutshell, that's where we're at today. I highly suggest if this is your first meeting or second meeting, that you actually go and watch at least the first meeting video, and maybe even the last one as well, as it gave a good overview of what we have done so far. But the first meeting video has our starfish story and a quick presentation on trauma on it. So the link for our YouTube channel was sent out and will be sent out with every invitation email that I send out to the group. All right, so exciting stuff is happening today. I really want you guys to speak up and share as we move along with our strategic plan, the ABCs today. Any ideas, any suggestions, anything at all, just share. And I will take notes as we move forward, and that is going to help us. I'm going to share my screen with you guys. Any questions so far from anyone on anything? Okay. So we had just briefly begun talking about the ABCs of trauma and what kind of that looks like. And I had sent out this form, this document, breaking down some questions on there so we can start having discussions. One of the first things on here with a A is, how do we really surround our community members and prevent traumatic events from happening in the first place? That's going to be kind of part of our discussion. And I just quickly wrote down this morning, awareness and education, prevention services and trainings, child abuse prevention and permanency task force, getting involved with that, social media blast and community events. So what comes to mind, you guys, from anyone's perspective, ideas, thoughts, when you read the question, how do we surround our community members and prevent traumatic events from happening in the first place?
You need to know about it, have the knowledge, inform them.
Right. So that's kind of come with the awareness, right, and education.
Yeah. Yes.
Inform what, community members?
Yes.
Okay. So when you say that, inform community members, what are you thinking about? How would that look like? How do we do that?
Pastors of churches, community leaders. Maybe we can do the train someone there, and then they can in turn train or get the knowledge out.
Okay. And when we say train, we're talking about what? The resilience documentary? Are we talking about TBRI? What are you thinking?
Anna, I think we have to meet people where they're at first. I think we have to understand where people are at, because there may be some preconceived notions in our community that we have to address as well, right? Because our own personal experiences inform our opinions and our understanding. And so there may be some false narratives that are out there that people hold on to already as it relates to trauma, or people who've been affected by trauma. So that could be part of kind of the awareness and the training piece too, of kind of resolving a little bit of what is truth, what is perception, and then be able to kind of train from there. But I think we've got to meet people where they're at first.
So how do we do that then? That becomes the next question. How do we figure that out, where they're at?
I think a big part of it is engagement, and at different levels and different aspects. So whether that's in the schools or in community centers and neighborhoods, not just assuming that one population is experiencing something, but actually going in there and finding out from them what their experiences are and how they're navigating those things. Another thing for me is, I think an important aspect to buffer some trauma is by having community connections for people to be engaged with. In isolation is like the root of other traumatic events and abuse and other things. So if people feel like they're connected to the community and invested in that community, then I think it's a buffer for trauma.
Absolutely. And that really comes back to the whole word to word, right? Like we spread it person to person sometimes. We start having discussions. Okay, anything else?
I think one of the things we can do, Anna, is you want to kind of gauge the interest. What is the interest of the community in trauma awareness, and start kind of slowly doing it that way. And what I mean by that is you can have like a seminar. You can do like a seminar and invite people, the public, to come, and you're going to get the ones who are interested.
Mm-hmm.
You're not going to get people that are not interested.
Mm-hmm.
And you may only have 10 people, but you got to accept the fact, okay, if we only start with 10, we got to start somewhere. And then begin to teach them about these things, make them aware of these things, and start doing it that way, because really you got to gauge the interest and start working on the interest, because now you got to get those 10 people to go talk to 10 other people, and so on, so on, so on. So that's kind of how I see this thing gradually, because if the people are interested and they want to know about it, those are probably the ones that are suffering some type of trauma and want to figure out where to get help and how to get help. So I think that's an avenue that we can look at, doing it that way. So that's just my input.
Yeah, I think that's great. And on that note, actually, what we're hoping to do, it's crazy ideas come to mind, but I hope you guys can hear me. It says the internet connection is unstable. I love having some sort of event, and I would love to actually have an event in maybe August after school starts, for community members, but also especially organizations and churches can be part of that, or whoever, where we come together and have a little mini seminar, maybe half a day or something, where we can present to the public what we're trying to do as Hope for Highlands, what trainings are available, what services are available, and kind of get the community back on track from this whole COVID shutdown as schools go back into sessions. That is something that I've spoken to Sarah Beth and Marissa and the Children's Services Council a little bit about. And I'm hoping that we can maybe make that happen and get it ready to go by August, end of August. What do you guys think about something like that? Would that be a good starting point?
And I think I like that idea. I was going to go along with the importance of social connections for families. We know that it's an important protective factor. And then it's kind of like from there, you can build that trust, and then people will be, more willing to maybe listen to information and to be more receptive to information sometimes when opportunities like that come about. And I think about it also in the context of my program. We've been talking about, how do we go back to providing those opportunities to families? We used to do large gatherings, to where families could network amongst each other and stuff like that. And so, whereas, and a Zoom meeting could happen, it may not have the same type of effect that a face-to-face interaction may have. So I like the idea a lot of what you're presenting to the group too.
Yeah, I like that. I'm wondering, just hearing you talk about, handing out information, I wonder if we can put together, and my team is going to kill me, I wonder if we can put together some sort of handout for maybe different groups. So let's say a client, family in need, a handout for, an organization, a handout for a business person. Remember what Chris said, kind of focus the message on the group a little bit in the past meeting. Wouldn't that be nice for us to have something like that kind of focuses on, hey, trauma for a family. This is, child abuse prevention stuff and include in that, or whatever, For a business person, it might be more of, yes, overall, hey, Hope for Highlands, did you know you can educate your employees and become trauma informed, for example, so that we cover different bases?
Yeah, and I was actually thinking something along that line as well. I think it's important to normalize the conversation for people so they feel more open to actually even discussing it. But one simple way of doing that is with the awareness, with information sharing. Because I know for myself, when I do trainings and stuff, people, we don't have a Red Robin around here, but when I ask people, well, what is the little commercial? It says Red Robin, and everybody goes, and there's no Red Robin, but people are aware of it. And so I use that to bring the group back to one, but it's something that's embedded in their minds, and it's not even something that they are engaging or going to eat at every single day. But once you start putting those messages out there and that information out there about it's okay to seek help, it's okay to talk to somebody about tough things that's going on at home or in church or at school or whatever, then it becomes a part of their everyday living without them even realizing it.
Yes, and you know what? That's great. We need a slogan. We need a slogan, you guys. Like a catchy little slogan thing. I'm gonna write that down.
And Katie, and I love where you're going with that. I love where you're going with that because I think we have multiple streams, right? Like I think we're not just talking about walking down one avenue that is this giant term called community. I think we have an opportunity to look at different streams that all feed this river. And so whether it is policymakers, decision makers, business leaders, beneficiaries, children, like there are so many different, as we're talking about tailoring the message to meet the need of that, specific client or that specific individual. I think we have a lot of streams that are going to feed the river that we can come to and be able to have solid conversations with.
Right. And Marissa, excuse me, just so you guys know a little bit about what my position is at Heartland, I'm actually a resiliency coordinator for a new grant program that we have with Florida Blue. So my job is to train adults on ACEs because we have partnered with Central Florida Healthcare to implement ACEs in their clinics. So I'm starting in Lakeland and it's a 4-year project. But I say that to say, if we have people to understand how trauma affects their health, because people want to know what do they get out of it, right? And so if you get the knowledge of, it's going to prevent you from going to the hospital as often if you get the help that you need with the mental stuff. It's going to prevent you from having the high blood pressure if you address some of the trauma and triggers that you have. Then people will make that connection and say, okay, well, let me find out a little bit more about this trauma and how I can prevent having to go to the ER every 5 seconds, spending all this money on insurance. And then when Marissa says it's different streams, that's another stream where even at county officials, hospital officials, we show them the dollars and cents that come along with knowledge of trauma and how it affects people. If you understand how expensive it is to run an ER because people are always going in there because of anxiety and not addressing those things or other health issues, then it starts to make sense that we need to get trauma under control so that we could reduce the cost that's associated with it.
Yes, ma'am.
Yes. This is what we're doing.
Yep, I agree with you completely. Again, I think that getting the ACE scores into primary care offices is really, really important. But I also I'm wondering about our court system maybe possibly somehow helping in this process too. We have parents who are drugging and fighting and who are neglecting their children and exposing their children to all types of trauma, whether it's overdoses or domestic violence. And I think that the parents need more education as far as the impact that it's having on their children. When DCF gets involved in such, for example, they refer the parents to counseling, or they refer the child to maybe trauma-focused counseling, but the parents aren't getting educated as to the impact on the child. I see that as a missing piece in this puzzle. That the parents are, the kids get dragged through the dust of many of these parents who are exposing the children to trauma. And again, what I'm seeing is that if it's a domestic violence type situation, the parents are being told they have to go to counseling sometimes, or mediation, things like that. But I just don't think they're getting the gist of how that type of trauma is affecting their children.
Yeah, and Bernadette, I would also say too that more often than not, I would be willing to bet that we're dealing with parents who also have unhealed trauma, right? So the addictions that we're seeing, the abuse that we're seeing is often carried forward from generation to generation, and a lot of it is unhealed trauma at the parental level. So it's almost, you know, helping, figuring out how to help that parent heal so that then they can understand what they're inflicting on their children and then know how to do it differently.
I have a suggestion.
Yeah.
Typically in those cases, before it even makes it to court, you've got entities such as law enforcement and DCF involved. Why not ask to have a meeting with some of the DCF and, you know, see if they can do something, hand out information or just something and catch it more towards the beginning than when it, you know, if and when it actually makes it to the court system.
Well, I will say, because my prior role was working with DCF hand to hand, and then I also worked for DCF directly. But prior to my current role, I was over the Bartow office for DCF, doing trauma-informed care and that kind of stuff. And so one of the things that we did a lot of upfront stuff with, Liz, was family team conferences, getting the families at the table with their supports, more family members than professionals, for them to understand how their behaviors are negatively affecting their kids. So before we even take the courts involved or say go do counseling or any of the other stuff, we really try to get family team conferences involved. I've gone out a couple of times in the field on special cases to say, hey, this is how serious this is. Let's try and figure out a plan. But you know your family better than I do, so let's figure it out together. And so there are some efforts in place to get the families understanding and buy-in to changing those behaviors. But again, like Marissa said, a lot of times it's that generational thing, and it's that ongoing unresolved trauma with inappropriate coping mechanisms. Because I didn't address my trauma, now I am doing drugs, or I am being neglectful of my children. So I think the root starts where they understand where their trauma is and where their hurt is, and then they could better help take care of their kids after that.
Yes, absolutely. And I happen to be an old facilitator of family team conferences, so I know how well they work. And I'm also excited because I'm hoping that our Children's Advocacy Center is going to get the family resource staffings going again. And that's kind of on the same level as the family team conferences. So I'm hoping that will happen. So that's great. Great input, y'all. Anything else?
And so one other thing, you know, we're going back and talking about how to get the churches involved.
Sure.
I think our avenue in getting churches involved is going to be through focus groups like Grief Share. Okay, we have a lot of churches do Grief Share.
Are you saying
they're
group
dealing with
share?
deaths in the family.
Group share, is that what it's
Grief.
called?
Grief.
Oh, grief.
It's called Grief Share.
Okay.
Grief. That's all over the country. You can go anywhere in the country and you find these Grief Share focus groups. Okay. And they're basically people who have lost loved ones or someone close to them, and they meet, you know, different times at the churches or wherever. But what I'm saying is you want to target someone in the churches, because the chances of getting a pastor to take this on is, you know, amidst all their other shepherding, I think is going to be a challenge. So I think what we want to do is we want to focus on establishing those focus groups like the Grief Shares, and these are, get someone in the church to come to this meeting, train them to run these focus groups, to get people who are interested, number one, or affected or interested in helping someone else. So I think the avenue in the church is doing these focus groups. Maybe come present it on a Sunday morning or something like that, or setting up a meeting by itself, and then invite people to come at the churches. I think that's the way to do it with the church. So that's just an idea.
I love it. Okay, I think that's great. Yeah. Anything else that pops out, you guys?
Yeah, I think I'm listening to everybody. Everybody's got really good advice and information that as you're putting the list together, you're sort of everything's shaping together, and my wheels are turning, and I'm thinking if we're able to put together I know you had mentioned starting in August, doing something in August. But if you set up almost like a series of ongoing awareness and education kind of style seminars, or almost like a program, series that specifies specific topics in a particular session. One session could be, about trauma-informed care. Another session could be about, we're just talking about the problems in Highlands County itself, the numbers in Highlands County, all of that awareness and education. Then, another session could deal with more of the national level, but little by little start to educate and aware the community of the problems that trauma has on society and the long-term effects that it has on your health. Because there's so much to it. It seems like it would be very difficult to cram it all in and just try to get the point across on just one sitting. I think it would be overwhelming. But if we set up almost like a series, like when you have a sort of like a TED Talk kind of thing, with you have a long week series running, and you could host it at different places. And if we're able to come up with an actual program that we can, all of us that are involved in this, in our group, can actually go out to different parts of the community and basically present this program. So now we're all going out, not just as a person in one specific place, but rather, let's say myself, I could go present this at a church and do a week seminar there. And Anna, you could be presenting it at the hospital. And then maybe Bernadette could be doing something, or everybody here being able to spread the message, kind of like the trauma prophets. You're going around, the apostles of trauma or something like that, but you're basically going around and you're spreading the word, and then you start getting maybe more traction that way throughout the community.
I love it. I think that's awesome. How cool that would be. And actually, I really love the fact that you said going to different places, because that will involve them so much more than having them just send maybe one representative to a training. I love it, Victor. I thought that was the greatest thing. Okay, I'm on board.
Yeah, I love that too, Victor. And I loved how you said TED Talk, because I am such a big fan of TED Talks. And I think, we could have a Highlands talk, and a series of that. And I know, Anna, you and I have spoken briefly about this before, but it's like this community of people we have on Hope for Highlands we're kind of unintentionally or intentionally, I don't know, building a little bit of a curriculum, because we have Marissa, who has the resilience in the TBRI, and then Sadie and I both now have the Darkness to Light Stewards of Children training. And I know that I've gotten lots of book recommendations from several of you guys. And so we're starting to build our own curriculum of tools that I think we ourselves are using. And how cool that we're building this whole library of resources for community members. And if we can figure out a way to tie a lot of those together and think of one, I know there's no one direct message for all of this, it's so complicated, but if we can kind of bring together an effective way to get people bought in, but then also give them the tools they need so that they can empower themselves, whether that's through training and we're working together with them, or if they want to do some of their own research and we, have a little library of books that we can lease out about trauma. That would be cool too, to eventually have those kind of resources all together in one place where we all have one message that we can share with those resources along with it.
Yes, absolutely. Yes. I love it. I love the fact. Yes. I even had Marissa with her TBRI trainings and stuff send me a little summary of her trainings, right? So I have this, summary of her trainings. That's perfect. We summarize all the trainings and say, hey, this is what we can do, you guys, in our community for whatever organization. You can pick and choose, or you can go through all of them, whatever you feel like you need. I love it. I think that's brilliant. Anything else, you guys? Okay. All right. Think of that slogan, you guys. It's on my mind. Anyways, okay, let's move down to the next one and see if we will have some other discussions. So how do we build resilience in our community members? Well, it's really part of what we just talked about, right? But also focusing on the 8 C's of resilience: competence, confidence, connection, character, contribution, coping, control, and consistency. How do we promote those things in our community members, talking about children and adults and even elderly families?
I think a big part of this is just being honest and being truthful. I mean, I think a lot of the things that we want to build awareness for are really hard to talk about. And if we can find a way to have a clear and honest message that it's easy to understand, I think that's a big part of it. And I recently have gone back to this example a lot in my personal life. Is my first time being a part of a DCF report. Bernadette, I know you remember this. I sat in your office and we talked about what we should do, and you and I sat there and ended up making a report together. And just sitting there with Bernadette during my first time making a report and having her support with that and listening to her talk to DCF on the hotline, man, that gave me so much confidence the next time it was time to do a report. And I think a lot of that was her honesty and the fact that she was willing to let me sit there with her while she made it. So I think that goes across anything that we do as far as trauma related, is if we can be just honest and supportive and offer those opportunities for learning for our peers and whatnot, then that goes a long way. And the more we practice that, the better we'll be able to portray that to the community.
Oops. Yes, absolutely. Good example. How important support is even amongst us as adults and what we do. And that's how we build resilience a little bit. Absolutely. Anything else that stands out to you guys you can think of?
Well, piggybacking on that, I think it's really important, again, that we get a message out there. So there's a level of shame that comes with experiencing trauma in your home. And I think so often that's why things stay secret. That's why maybe they go on longer than they should. And I just think it's important that families understand that things do happen in other homes besides their own, and that the healing process, the resiliency process, takes place by coming forward and understanding that you're not alone in this type of pain or environment. And again, I think there's just so much regarding education. The more we bring it out of the closet, whatever, if somebody's going through trauma in their personal lives and it's not being addressed, understanding that they're not alone and that there are ways to recover from this. I think it's so important. I don't know that we can prevent so much. I don't know that we can prevent so much trauma, but I think if we can educate individuals as to the impact of trauma on others, we may actually, I don't know, maybe we can prevent it. Obviously, we couldn't have prevented something like the SunTrust Bank, but if we continue to get prevention messaging out there into the community, people may think twice about the words and actions that they choose, knowing the long-term effects that it can have on people's lives and health.
So I know like the resilience documentary, right, talks about the importance of establishing that trusting, close relationship, someone in your life that you connect well with, that's the supportive one. I mean, that's what this is all about, right? So how can we establish more, supportive relationships with our community members in some way? I don't know.
Public messaging.
Did you say relationships, Anna? That sounds a little like TDRI.
I know, right? Yes, absolutely. Supportive relationships.
And I know I've seen in the.
Go ahead.
Oh, I was just going to say, I've seen in some school environments, like the counselor's office may have like a sticker to indicate that it's a safe place for somebody who might be identifying as lesbian, gay, bisexual, or whatever it might be. So maybe just even a little symbol of like something to indicate that this is a safe place to talk about your trauma and not be judged. Maybe a indicator, a visual that people can recognize throughout the community and realize that it's a safe place for them to express those concerns.
That's what I'm hoping this will be. I know you haven't been part of this. This probably makes no sense to you at all. Our initiative, our initiative is based on the starfish story. And if you watch our first video, I talk about the starfish story, but there's more to it than what you might know. So the starfish has become a symbol, and it's our logo for this initiative. So there's starfish in our communities, and they might be stranded on the beach, right? And how do we all come together to help them instead of just one picking one up and, not making that great of an impact? Does that make sense?
Is this a story where they all wash up on the shores and the guy's just throwing one and they're like,
yes.
How are you going to save them all? Okay, yeah, I know.
Right. How are you going to save them all? Well, we can save them all if we come together as a community. That's the whole point of doing this, trauma-informed community. Probably still can't save them all, but certainly a lot more than, yes, one person can have the impact of doing. So,
I'd like to add on the note. I'd like to add on the note to do a PSA saying something like, let's not keep it a secret anymore, or no more family secrets, and then put the hotline or the phone number underneath.
That's it might even be a cool idea to have it as a school competition for the high schoolers to come up with a PSA and get their involvement and their buy-in just by being a part of the process.
I like it.
I like it too. I think that's great. Very good. Okay. Anything else? Oops. Thinking about the resilience.
I have one thing to say. I think I almost see this like a two-part thing.
Okay.
Where we talked about the first part with creating a trauma-informed community is such a big first step to go into step two, which is building resilience in the community. I feel that once that mountain to climb is completed, then I think the resiliency part becomes a lot more, it becomes a much more effective topic that you can communicate and get involved, people in the community and other people in organizations after they've basically taken the bait of the trauma-informed community. Once they understand, they get involved, I feel that you're going to have much more strength in numbers to be more effective, to start dealing with resiliency and how to treat trauma for people that have suffered, whether it was in the past or they're currently going through problems now. that being said, as I'm hearing everybody, I kind of started getting this idea in my mind of one thing that Highlands County lacks a lot of is definitely places for the youth to go to. I have kids, and it's always sort of a problem to try to find, where can I take my kid? What can I do? Where can I, Highlands County is very limited. Unfortunately, there's just not much for children. And that's one of the biggest reasons there's so many problems in Highlands County. There's a lack of outlets for children, and there's a lack of outlets for parents to get involved with their children in the community. So therefore they stay at home. They just live in their toxic bubble all day. The parents take it out on the kids, or the kids are around other kids that have nothing to do. All of this creates a big problem that eventually will fuel some kind of incident or kind of a problem. So I was thinking how cool it would be to have some kind of resiliency community center where we have, this is obviously something that will go down the road, once you get people that are really jazzed up about trauma and want to do help, but eventually, having people to put money into a project where you have a big place, kind of like the YMCA, but it would be a resiliency community project where children and families can go and they have a place to engage in doing music, in doing art, in doing sports, in doing literature, writing, just giving them outlets to start building up resiliency and find within themselves where these 8 C's come from by having people, again, that can provide the tools. It's very hard to get people to connect to this idea where there's no tools that they can use.
Yeah. So I think they do some of that at the Boys and Girls Club, but I like the idea of what Victor said, that maybe, if we had a developed curriculum, that maybe we could somehow get it instilled, like at the Boys and Girls Club, the YMCA, youth groups at churches, that could be part of their curriculums to provide to the children of our community.
Absolutely.
The center that we watched from the training, Marissa's training on TBRI with Karen, and they had that center there, and I think it was Texas. That's more or less the idea that comes to mind, something like that, where they're so diverse in what they're doing. Obviously, they're dealing there with predominantly fostered kids and stuff like that, but sort of springboard of that idea into something that, you can definitely get even kids like summer camps and all this, where you have kids helping other kids, mentors, and people getting involved and helping out. It would really be a big community effort.
Yeah.
That's a great idea. And I will say that a couple of years ago with myself and Bill Nunley from Heartland, we went to Georgia to vet TBRI, and we went to this location. I can't remember what part of Georgia we went, but they had their own building. They used this old school and turned it into something similar to what he's talking about, like a resiliency center. And so they had different classrooms that had different areas for food and for just engagement with kids and families and all that. And it was a great thing. And they had summer camps and they taught all the TBRI stuff, which was great. But they had to take some time to get there. But I think if you make that connection with the staff at some of these youth groups and YMCA and get them trained on trauma, TBRI, and how to engage kids, and it could be a partnership that could kind of propel into a resiliency center like that later on down the road.
Yeah, I absolutely love that. And, I think I just totally lost my train of thought. I'll come back when it returns. Sorry.
All right. Marissa is our TBRI guru, so I'm sure she'll come up with something. All right. I love it. I love the ideas, you guys. This is awesome. What else you got?
Wait, it's back. It's back. It's back. I think one of the obstacles and one of the hurdles that we have to be able to get over and that we have to face and address in our community is that sometimes we forget not we, because we all work with families, but our community forgets that there are families here. And I know that that sounds crazy because our school board is one of our largest employers, but our community, to Victor's point, our community is not always focused on the fact that families live here with children and they need resources for families. And so I think we have an opportunity to highlight that a little bit. You know, we focus a lot in our community on our snowbird population, which is important. We need to. But I think we can't neglect the fact that we have a huge amount of families here. We have a ton of children, and a lot of our folks don't leave. And so we're going to see those families continue to grow. And we want to be a place where people want to move from, where they want to move from wherever they are to come to our community. And we have to have the resources for them to be able to do that. Whether it's housing, whether it's activities, whether it's all of those things. And so I think we have an opportunity to engage that discussion at the community level.
Awesome. All right, you guys, hold your thoughts because I realize it's noon, and I actually had asked Sarah Beth and Mercedes to quickly talk about their training, which is Darkness to Light. So if you guys don't mind giving them a couple of minutes, sorry, it's already pretty much noon, but let's hear what they have to share about their Darkness to Light training.
Sure. Thank you for inviting us to share a little bit more about that. So Sadie and I have both recently become facilitators for Darkness to Light's Stewards of Children training. And basically what it is it's a 2 to 2.5 hour training that goes over the 5 steps to preventing child sexual abuse. So it does focus specifically on child sexual abuse and prevention of that. But it is, to me, just a great training for almost anybody in the community. You don't have to know very much about what sexual abuse is. You don't have to necessarily work directly with children or have your own children. It's just a great, to me, overview training of child sexual abuse, what it is, what it looks like, how to report it, the things that can happen to a child who has been sexually abused, the kind of resources that you probably should be looking into if you're with a child who has been sexually abused, those kind of things. But it gives kind of a good overview. And what I've seen so far out of the people that we've trained is it's something that pretty easily promotes buy-in, because I think we can all agree that children should not be abused, but it gives you kind of 5 steps how to prevent it. And then it, to me, gains a lot of interest. So from it, like if I were someone who had just watched the Darkness to Light, it would be something like, okay, what can I learn more about abuse and what that causes to a child? And I think that would be a great intro to saying, well, I probably should watch the resilience film. I probably should learn more about how to interact with a child who's been abused or has trauma. So it's a great, to me, like intro to this topic. But it's also something I think everybody should know, because I think everybody should have the confidence to report something, the confidence to say, yes, that is a sign of abuse and I do need to say something about it. So it's just, I think, a great training. There are different tracks for it. So for example, we went to Champion for Children earlier this week and we focused on the youth service organization track, but there are different tracks. There's one for just a community member. There's one for families. There's one for faith-based organizations. So it's one that we can tailor to different organizations. So yeah, does anyone have any questions about it? No. Okay. If anyone's interested in bringing Darkness to Light to their organizations or maybe their church or something like that, I can give you guys my contact information. I'd be happy to talk to anyone about it and get some more scheduled. Sadie and
How long is it, Sarah Beth?
2 to 2.5 hours. Yep. And then Sadie and I have a goal. Well, I'm kind of really pushing this goal, but Sadie's on board too, of training 5% of the adults in Highlands County in Darkness to Light. So that would be 4,284 adults, because I'm reading the book Tipping Point. It talks about 5% being the tipping point for a catalyst of change. So that is my own personal goal for it. So if anyone wants to help me reach that goal, please reach out to me. I think that would be fun to
Well,
for
thank
sharing.
you. Yes, thank you. And I know the Champion for Children Foundation staff has had this training, so we're all trained, and I can highly recommend this training to all of you. Does not matter if you have children or not, or if you work with children or not. This training is literally for everyone. So sign up. You don't wait. Thank you, Sarah Beth. So yes, Carissa, did you have something?
Oh, we were just saying, you say explain, but we did want to just once again grab Sarah Beth and Mercedes, because it is really good, because like Sarah Beth said, there are different tracks. So for Chris and Dana, we're to share with our other churches, with the faith-based side, but from parents and families to organizations to just our average businesses. But even from our perspective at the Champion for Children Foundation, Sarah Beth and Mercedes did a great job of just making it is a very hard topic, like a lot of things that we deal with. And so just for us to even experience that training, now we can go out and share with others how it is something hard to talk about, but the way they present it is very easy to share with other people, and it's for anybody in the community, not just those of us like all of you that are in the field. So we just want to say thank you again to Sarah Beth and Mercedes.
Awesome. Perfect. All right, you guys, I think we had a great session today. We're going to continue this work next time, continue our ideas, use brainstorming. And as we do that, I'll go back on the notes and kind of start putting it together in different ideas and what fits where. That's kind of will be my job to figure that out. And thank you. I mean, thank you. I really, truly mean that to all of you for participating and doing this work. And this social change that's going to happen in our community with building a trauma-informed community is just so important. And we're going to do so many good things with it. Truly, truly amazing, wonderful. From the bottom of my heart, I appreciate every one of you. So thank you. And I'll see you in 2 weeks.
Thank you, Anna.
Thank you.
Thank you.
All right. Take care, all.